Keen to gain hands-on experience before jumping into private practice? Steph Bruss tells us how taking the scenic route in your career might give you the exact knowledge and skills your therapeutic toolkit needs. Professionally Psyched is the podcast that brings you cutting-edge psychology research and real-world insights from our psych community of clinicians, researchers, and educators alike. In our special alumni spotlights, we chat to graduates from our psychology degree programs about how their skills learned in the classroom have become powerful tools supporting diverse career journeys and successes. Hi everyone and welcome to Professionally Psyched. I'm Jessica Muller, PhD candidate in Public Health at James Cook University, and before we get started we'd like to acknowledge the custodians of the land on which we record, and for me today that's the Bindal and Wulgurukaba peoples. And I pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples and cultures from wherever you may be tuning in from across the country. In this alumni spotlight, join Dr. Amanda Krause as she sits down with Steph Bruss, a registered psychologist whose career path included a stint in Mount Isa before completing her registration. Steph reveals how her experiences taught her to view each client through multiple lenses. So grab your headphones and get ready to get professionally psyched about embracing non-linear career paths. Enjoy.
Steph, thank you so much for joining me on the podcast today. To start, would you please introduce yourself?
So I am Steph. I am a registered psychologist. I'm from Townsville and I work in a private practice, and I've been registered now for just over 18 months.
I would love to hear a little bit more about the registration process, because sometimes when we enter a psychology undergraduate degree, we don't always know sort of the actual pathway to get to registration.
Actually, the person who connected me was Dr. Anne Spinborn. She was my supervisor during my fourth year. So anyway, so that she put me in touch with a potential supervisor, and that worked out. And I landed my internship, at a private practice in Townsville. And so that involved lots of like hands-on sort of learning and lots of study and theory sort of stuff as well. And like in the moment sort of learning. So you're really like applying your theory and your practice all together. That's sort of how I did that. But that was a lot of, doing a lot of case studies and studying for your psych exam and, filming your practice and stuff like that, and lots of discussions and learning. So, so that's the path I took. But, I did have quite a detour before I come around to that after finishing my degree. So.
You mentioned a detour. Was that still connected to psychology in some way?
Yeah, it was. So I actually went into caseworking. Well, particularly I worked in the child protection space. So I actually got a lot of my learning. So a lot of my learning that I brought along to my internship and to my role as a psychologist come from my background in caseworking. And I actually worked in rural and remote sort of settings. So I worked down in Mount Isa and surrounds, and did a lot of immersion in terms of culture and learning about different like family systems and behavioral stuff and trauma and, all of those sort of really big ticket topics at the moment, and trying to apply my learning, learn new things and integrate it all in one time. So that's how I sort of started. And I actually stayed in the community services space for probably about 6.5 years. And I did a few different roles. So I worked as a caseworker. I did some domestic and family violence practice. I did some team leadering and lots and lots of skill stuff so that I could, work out what I wanted to do. And then I was like, okay, it's time to, do something a bit different and more aligned with, I guess, my values and the things that I wanted to do. So.
Yeah, and I'm curious to see if you could tell us a little bit more about how those experiences out in Mount Isa now get brought back into the work that you do today.
Yeah, that's a great question. Working out in Mount Isa, like you're coming along with all your theory and you go out and you're like, wow, I'm in a really remote sort of place. I was fortunate enough that I had connections and stuff there with family and things that really helped that process. So, but I know for others that was a struggle first, was just being there and not knowing anyone. And then you kind of just like put in there. So, and it's about like, I guess when I was doing that, I was really like curious. So I always maintain a curious mind and really wanted to know more. So I never sort of was like, I know everything. It's you never can be like that. And so it's about going into places like that with an open mind and acknowledging and respecting that people have many ways of doing things. So just because I've learned one way or I've had my own experience a particular way, that doesn't mean that is the be all and end all. So it's really about going in with an open mind and learning and like listening to people's stories and then working together. So that's something I do in my practice now. It's not about like, oh, you've come to me because you have depression. Here is a depression intervention. It's more like, so tell me more about that. Like, what's the origins of this? And, thinking about it from different frameworks. So when I was working in Mount Isa, I had to really work from a cultural sort of lens and being mindful about my own cultural background, my own privileges and things like that, and working in partnership with others. So in that particular one, I had other local people I had to work with, but in private practice now, it's just about like, really taking the time to listen and understand to the person who's in front of you and what their story is, and acknowledging that, they've got their strengths, their insights, their own experiences and their ways of doing, and, working out how best to work together to best outcomes and things. So, that's something I had to like really learn on many different levels. Yeah.
On that line of thinking, what do you think it was? Was there a subject, a topic, a lecturer? What was it that you really drew on from your undergraduate degree when you sort of got dropped in Mount Isa and suddenly had to put theory into practice?
To be honest, the first thing is like, I know nothing. So, that's probably a point of validation for most people when they come out of their degree. They're like, I feel like I don't, what did I learn? How do I apply all this stuff? I probably at the time wasn't as conscious about making the links, but I think now, a lot of the behavior stuff. So behavior patterns and its fundamentals. So, you would see some unpleasant things and you would notice that was a cycle. You're like, okay, so when they do this behavior, then this would happen, and people can sort of really predict it. And then it's about, okay, so how do you sort of interrupt that? And then also thinking about psychopathology and thinking about what are the different things that I'm working with. So obviously lots of like substance use stuff and anxiety and depression. And I always think about kind of like having camera lenses, and I'm just like constantly having to put new camera lenses in front of it. So if you're thinking like, okay, so if we've got, even from an attachment perspective, so if we've got lots of disrupted attachments and probably more in the reactive space, and we're thinking about borderline personality disorders, and those are pretty common to come across in, that sort of space. So put those lens on, then you're like, okay, so then we've got like a behavioral lens as well, because now we've got behavior patterns that come along with those presentations. And then we've got the cultural lens as well. And then we've got history and intergenerational trauma and all of that sort of stuff. So I couldn't tell you specifically one subject that was most fundamental, but like they all sort of come in. And because my practice after uni was in child protection space, so attachment and trauma is some things that I like now. Even in practice, I was like, oh yeah, I've seen this before. Like, I understand how this works. Like I really had that learning solidified. Yeah, so I can use that in my private practice now in terms of how that all works together and how that informs like other sort of, depression, if your attachments are, more on the anxious avoidance sort of side, and that all feeds the other things. So everything's really connected. So yeah, it's really fun to try and think about it. Actually, I really enjoy the challenge of which way am I going to look at this?
I really love that idea of the camera lenses and really drawing on a wide toolkit to figure out the patterns and what's happening. In your private practice now, is there something you specialize in or a type of clientele that you primarily work with, or is it very vast?
Probably a little bit on the broader side at the moment. So my areas of interest definitely are working with like particularly women who are working to regain their identity and their sense of self, especially after pregnancy or becoming a mother. So that's one of my favorite areas. But in general, like I love identity work and helping people understand themselves and learning about who they are and living their authentic self, and then watching how that sort of radiates and then, helps them with their things like anxiety or their mood or gaining stability. And, I work a lot with like neurodiversity. So that was something that was quite new to me when I started in private practice. So learning a lot about autism and ADHD, working with people with intellectual disabilities and Tourette's and OCD. So lots of different things. So it's rare that I have one clean cut presentation. They're often multi-layered and quite complex. So actually, I really enjoy complexity. So those are kind of my sort of favorite things. So helping people overcome that, not necessarily overcome, but, work within what they've got and finding a balance, depending, again, really depends on the presentation. But helping people find their authentic self and being able to live within that.
I think it's great that you have verbalized how you came out of your degree feeling like you maybe didn't know everything, and just then you also said, and then this was new, and you're needing to learn about more things, and learning's a journey that we're always on, right? So
Correct.
I appreciate that, and I think people listening will also appreciate that as well. What do you do now to stay on top of the research to help you when you're working with clients who maybe have a presentation of something you're not as familiar with?
Yeah, so I am fortunate enough on the first sort of level to work within a practice where there's a few of us, so a few different sites, and we have an OT as well. So we get to often talk, and if it's something that I'm not particularly familiar with, or it's not an area that a presentation I'm seeing a lot of, so I will always seek supervision or have a consultation with someone who probably knows more about it than I do, and that's quite normal for us because we can't be masters of everything. So we do a lot of that. But I also actually love podcasts. And, there's some really great ones out there that really do synthesize some of the research and in the practice side of things as well. And, the nice thing about that is there is a discussive element. So you get to think about that in terms of cases and stuff like that as well. I do a certain amount of PD per year, and I usually go above that. So learning different therapies and stuff. So at the moment, I'm about to do part 2 of EMDR therapy training as well. So keeping on top of that, subscribing to psychological societies as well. So I know there's APS and AAPI. So they come out with different information about what's new and what to sort of have a think about. And then you can go off and do your own sort of research about whatever it particularly is. So I think even the other day I was looking at some stuff around dyslexia and different bits and pieces. So
Yeah.
yeah.
And I imagine part of that is staying on top of making sure that what you do is evidence-based. So even if you're not conducting research yourself, you still need to be aware of
Right.
what's happening. And it sounds
Yeah.
like podcasts might be a great way to get some of the story that
Yeah.
isn't necessarily always in the written reports that we have to write.
Yeah. So, and even then, like, even if you're listening to podcasts, so that's like it's almost like a bit of a news sort of thing sometimes, depending on what you listen to. And then you can use that as a thing to be like, I'm going to go find out some more about that. And then you go and actually read your journals and
Yeah. So speaking of reading and learning and studying, do you have any top tips for people who are currently maybe undertaking their undergraduate study, maybe are trying to think about what their career path might be?
Yeah, so I think like keep your mind open about where you might work. So like again, my story in terms of working in case management and stuff first, I really felt like for my own learning and for my own practice that I really wanted to go out and do lots of hands-on skills building first. So even if you don't go straight into doing your 5+1 or your masters, like there's plenty of opportunities to learn the skills or a bunch of different skills. So even in my job, I had to do like safety assessments and risk assessments. So even in private practice now, like suicide risk assessments are extraordinarily common. And I had to do a lot of that already. So I had learnt, what to sort of investigate, what to sort of note. And I was able to bring that with me. And, that was big head start. There's transferable skills. So, even if you think about retail, like you've got to be able to have those conversations, and that's something, just a micro skill that you bring along to your work afterwards as well. So that's one of them. But also, like, being flexible in your thinking. So, something might not seem on the surface as, like, oh, I'm doing a psychology degree, I should go and become a psychologist tomorrow. Like, it's like, okay, well, I'm mindful clinical master's programs and things. Sometimes it's a bit harder to get into them. So it's like, what else can I do in the meantime? And yeah, go out, explore, get your experience. And then if it works out that you go on to do your internship or your master's program, cool. If you're like going to take a detour and I'm going to come back to it, that's cool too. So yeah, being flexible, open-minded, I think.
I think that's a great point to end on, that we need to be flexible and continually learning through our journey. So Steph, thank you so much for joining me on the podcast today.
No worries at all. Thank you for having me.
Thanks for listening to Professionally Psyched. This podcast wouldn't be possible without the ongoing support of our psych community. If you'd like to show your support, or if you want us to cover anything on the pod, reach out via our emails, and don't forget you can listen to full episodes on Spotify.